Hello, friends. Welcome back to the second part of COVID 19. And thank you for joining with us once again. So, before starting, let's do the quick review of what we have done so far. By now, we know COVID 19 is caused by SARS-CoV-2 because it is genetically associated or genetically similar to SARS coronavirus, which was responsible for SARS outbreak in 2003. And this coronavirus travels in a air droplets. So when the infected person's cough sneezes, it will be transmitted to the healthy persons or vulnerable populations. And the highest risk for acquiring this COVID-19 are elderly populations and those having the comorbid conditions like hypertension, diabetes, mellitus. Now, when the infected persons, when they travel to the non-affected area or non-endemic area, then this is called as imported cases. And if they start transmitting the infections or spreading the infection, those who come in contact with them, then this is called as local transmissions because it is usually isolated to the small area. Also, if the people becomes to contract the disease with no clear source, then it is called as community transmissions. And to prevent these community transmissions or to contain these community transmissions, all the schools, all the colleges, bank, markets have shut down just to prevent or contain the community transmissions. Now let's talk about the spread of infections, and this is interesting, and this is where I would like to talk to you in epidemiological point of view. So for that we have to know R naught. R naught is a reproduction number or reproduction rate given to any kind of viruses based on how quickly they spread the infections. Here R naught of 1 means that infected person passes on to the normal healthy persons, one healthy persons. Similarly, R naught of 2 means one infected persons will transmit the infection to the two normal healthy individuals. And this is a very nice graph showing the R naught reproductive rate. So from this graph we can see if R naught is less than 1, then it will cut down the infection. But if R naught is greater than 1, it continues to spread the infections. Whereas if R naught is equal to 1, then the infections will be steady state. And the R naught of COVID-19 is in between 2 to 2.5. So COVID-19 spreads quite a bit more easily than flu, whose R naught is around 1.3. And this lab diagnosis we have discussed in our previous video what specimen CD meant for diagnosis COVID-19. So basically we take nasopharyngeal swab or oropharyngeal swab or sometimes sputum specimen for diagnosing the cases of COVID-19. But of course the investigation of choice is reverse transcriptase polymerase chain reactions. This RT-PCR test is done to diagnose even a small amount of viral DNA. This will detect even a small amount of viral DNA. Now, coming to the treatment of COVID-19, treatment is mainly focused on the supportive cares like fluid, oxygen therapy, and ventilatory support. There has been no specific treatment of COVID-19 that is approved by Food and Drug Administration (FDA). So treatment is basically focused on the supportive care. Nowadays, patients with COVID-19 are given the combination of therapy of anti-malarial drugs like chloroquinines, anti-flu drugs, and even anti-HIV drugs. So this treatment is being used as a trial in some part of the country, but unfortunately we have no vaccine available to protect against COVID-19. So only important things at this point of time is prevention, and which is the most important things for now. And for prevention, we have a very wonderful mnemonics Wuhan, which is the epicenter of COVID-19. So Wuhan, from we can do the preventions. You stand for wash your hands regularly and frequently. Use your face mask. Have your temperature checked. Avoid crowd places and never touch your faces with unclean hands. So this mnemonics will help you to do the prevention of COVID-19 with the help of Wuhan, the epicenter of COVID-19. So prevention in areas with community transmissions. So anyone with a mild symptoms, wearing a mask and self-quarantine is the must. The main goal is to avoid person-to-person transmission. So anyone with a mild symptoms, regardless of whether they have been diagnosed or having COVID-19 or not, should wear a mask and they should self-quarantine within their home. Now for the individuals that don't have the symptoms but they are at higher risk, like those over age greater than 60 years and people with chronic disease, the recommendation is that they also do the self-quarantine to avoid the chance of getting sick. So self-quarantine means keeping uh, medications, groceries, and household items for some period of time. Also, they should have an emergency contact person with them. And now for the health workers who are around COVID-19, the recommendation is to apply the droplet and contact precautions. That includes the surgical mask, the gloves, the long-sleeved gowns, and eye protections like goggles and face shields. And also, when performing procedures that generate aerosols like tracheal intubations, like bronchoscopy, CPR, it's important to wear an EN95 respirators. So this will prevent almost 95% of small particles like respiratory droplets from passing through. Now coming to the current status of novel coronavirus COVID-19 in Nepal. So currently we have two positive cases of COVID-19. First cases was identified on January 13, 2020. So one of the medical graduate when coming back from Wuhan city to Nepal having the symptoms of coronavirus and was tested to Shahid Shukra Raj Tropical Hospital, and this was uh, the positive cases so far. And today, the second cases of COVID-19 was confirmed, and this was a imported cases who have traveled to Nepal from France. So she was a 19 years old female Nepalese student, and she is now receiving a treatment in a Sukraraj tropical and infectious disease Teku, and now government has done initiative to keep the person's family in a quarantine. So these are the national health response made to protect or control the novel coronavirus. Like thermal scanner is still in the TIA, Tribhuvan International Airport. So just have a look at the slides. And the advice given to the public regarding the prevention of the novel coronavirus is basically using a frequent hand washing, using a alcohol based hand rub or a soap waters for basically 20 seconds. Or while coughing and sneezing, cover your mouth and nose with the flexed elbows like this. So this is the way you should cough or sneeze. This will prevent the spread of the disease. Novel coronavirus बाट आफू र अरूलाई कसरी बचाउने, this is the most important things to protect yourself and how to protect others from these viruses. So these are the pictures that will help you to understand how to protect or prevent the spread of the disease. So avoid crowd places. Whenever you are coughing and sneezing, use this process and frequent hand washings, alcohol based solutions, or you can use soaps for 20 seconds and avoid doing hand shaking. Instead, do the traditional namaste. That will prevent the spread of the viruses. So WHO recommendations that reduce the risk of coronavirus infections almost the same. This is the procedures of hand washing, and the recommendation of mask is still very much important things to. So wearing a surgical mask, according to WHO, it is not recommended for a general public who do not have any kind of respiratory symptoms. So wearing a surgical mask is not recommended because they are meant to catch the droplet from a cough or a sneeze going out rather than preventing you from breathing in the viruses. So similarly, wearing this N95 mask is also not recommended because they are only meant to worn by the healthcare providers or workers. COVID, Novid. So this is Janhit Kalagi from Ministry of Health and Populations. Thank you. So this is for you peoples about the COVID-19, and I hope you enjoyed these videos. COVID-19, I guess, and the take-home message is it's important to protect yourself but also protect others by applying the various measures that we have discussed. Stay safe, and thank you so very much for being with us for around 25 minutes.